Talking about the fractures, the fracture is a break in the continuity of the bone, or it is a breach in the cortex of the bone. Classification of the fractures, it is depends on the various bases. So on the basis of etiology, it can be a traumatic fracture that is caused because of excessive force. There can be a pathological fracture because of osteoporosis, because of postmenopausal females in metastasis, tumors, stress factor because of chronic repetitive injury. On the basis of displacement, there can be either a displaced fracture or a displaced fracture. Undisplaced fracture means where there is no significant displacement that happens. In case of displaced fracture, there is going to be the distal fragment that is displaced in relation to the proximal fragment. Either it can be a twisting injury, a rotational injury, or a shift. Then, on the basis of external environment, it can be either a closed fracture or open fracture. Closed fracture is where the skin over the fracture is intact, and open fracture is where the skin is breached and there is a relation, or it communicates with the external environment. Now it can be internally open or it can be externally open. Internally open, that is the bone pierces from within, or externally open, that is object causes the wound from outside. Then on the basis of complexity, there can be a simple fracture, complex fracture. Simple fracture means when the two pieces are apart and they are easy to treat. But however, a complex fracture or comminuted fracture is where multiple pieces are formed. On the basis of force, it can be a high velocity or a low velocity. High velocity or severe trauma, the soft tissue damage is extensive and there is a slow healing. While in case of low velocity injuries, there is a mild trauma, minimal soft tissue damage, and relatively fast healing. Then on the basis of fracture pattern, it can be either transverse fracture, that is it is perpendicular to the lock axis of the bone, oblique fracture where the fracture line that is oblique, then spiral fracture where spirals in multiple planes, that is it is because of the twisting force. Comminuted fracture is because of the crushing force where multiple pieces are formed, and a segmental fracture is where the two fractures and one bone it gets separated in a segment. So talking about open fractures, so open fractures are the ones where they communicate with the external environment, that is skin is breached. Now on the open fractures, they have characteristic classification that is called as Gustilo-Anderson classification. So according to Gustilo-Anderson classification, there are three types. Type 1 is where the wound is less than 1 centimeter and is clean. Type 2 is wound more than 1 centimeter and there is a moderate soft tissue damage. Type 3 is extensive soft tissue damage and contamination or vascular injury is present. That is further divided into type 3A, 3B, 3C. 3A, that is adequate soft tissue cover is still present. In 3B, there is a periosteal stripping and bone exposure present. And in class 3C, there is a vascular injury that is requiring a repair. Talking about the radiological patterns, so the basic views that are used in orthopedics are the AP views and the lateral views, which are mandatory, and it includes one joint above and one joint below. Special views are required for scaphoid fracture, that is oblique view, or Judith's view is required for acetabulum. Now, the fracture patterns on X-ray. So, the transverse pattern, it means a straight line that is perpendicular to the bone axis is seen in transverse fracture. And in oblique fracture, oblique line that is diagonal across the bone. A twisting injury, there is a spiral fracture. Here we can have a corkscrew appearance. Then multiple segments can be seen in case of comminuted fracture. In segmental fracture, you can see two separate fracture lines and isolated bone segment in between. In case of impacted fractures, the fracture segments are rival into each other, and because of which sometimes they will not be visible. In avulsion, the small bone fragment it is pulled off by either a ligament or a tendon. Then fresh versus old fracture, how to differentiate on the X-ray. So the fracture ends in a fresh fracture are sharp, they are smooth in case of old, and soft tissue shadow is present in the fresh fracture when it is absent. The soft tissue shadow is because of hematoma. Callus formation seen in older fractures after about 3 weeks. And signs of non-union on X-ray. It can be either atrophic or hypertrophic. Atrophic means absolutely no callus formation and there are tapered ends, while in hypertrophy there is abundant callus but not breaching fragment. Then commonly missed fractures are in the upper limb, the scaphoid fracture, capitulum or radial head. In lower limb, the impacted neck or femur fracture can be missed, and otherwise the hypophyseal injuries can be missed.